To the Learning Lab. My name is Roman Garcia. Today I'm going to be demonstrating what the biomechanics for a normal shoulder. This biomechanic is a relatively easy pattern to identify. So if you allow me, let me bring in my model so I can demonstrate what a normal biomechanical marker for a normal shoulder. This is important. This is a normal biomechanical marker of a shoulder. So if you allow me, let me bring my model in. Anna, here, you're going to stand right over here. Now this is a relatively easy biomechanical marker to identify. So basically what I'm showing you is a really quick physical evaluation of how to determine whether you're dealing with a joint issue or a soft tissue issue or a combination of. But what this biomechanical marker allows the treating clinical practitioner to do is to identify whether the problem is of a soft tissue or if it's of a joint tissue cause. So if you allow me, let me just demonstrate it with Anna. Anna, what you're going to do first is with your hands in this position right here like this, very simply, just raise your arms overhead. Alrighty, now let it come down. Now, as you can see, this rhythm right here between the humeral head and the scapula was normal. This was a perfect rhythm. Obviously, she has healthy shoulders. Now, the next thing you want to do is evaluate the status of the rotator cuff muscle or the tendon. So what you do is you just simply ask the patient just to give him a hand. Shake my hand. Have them shake your hand. Shake my hand. Again, you saw the separation between the humeral head and the scapula. This is a rotator cuff muscle or a rotator cuff tendon that is not stressed. Now, this is the biomechanical marker, which gives the clinician an idea of what tissues are involved. And this is it right here. You bend the elbows 90 degrees, just like this, very simple. You just hold the hand. And what you do is you just elevate the elbow straight up like this. Now, what you're seeing here is you're seeing rolling and spinning and gliding of the surface region. You see there's no elevation of this upper quadrant. You've got separation between the humerus and the scapula. So in essence, now if a patient demonstrates this type of movement pattern, you know that you are not dealing with a joint tissue issue per se. You got normal, there is no dysfunction in this shoulder. You do it to both again. If there is not a degenerative condition in this shoulder will demonstrate this pattern. If there would be a degenerative condition in the joint surface itself, this humeral head will not separate, will not spin and roll as you are seeing right here. And, of course, check for external rotation. Again, normal external rotation. Normal external rotation. Now, Anna, what I want you to do is, with your hands in this position right here, just raise your arm. Let it come down. Again, let it come down. Perfect. Now relax. Now, the interesting thing about this biomechanical marker is that you don't have to, anybody can perform this in front of a mirror. If you got a normal functioning rolling and spinning of the shoulder, you can actually diagnose yourself by simply doing this motion in front of a mirror. Again, we're going to do it one more time. The passive. Now, Anna, with your hands in this position right here, again, raise your arm up and let it bring it down. Alrighty. Perfect. So Anna has healthy shoulders. Now, if Anna would be coming to me and she would be complaining of shoulder pains, I would have her go through this motion pattern. In my clinical mind, I start thinking her problem is not of a joint surface issue. It is coming from outside of the joint surface area. Now you start thinking in soft tissue terms. Is it a bursitis? Is it a rotator cuff issue? Is there some impingement of the tendon as it runs underneath the acromion? Again, you're thinking outside of the shoulder joint surface. Again, this biomechanical marker allows you to distinguish one from the other. Again, we'll just go through it real quickly one more time. This is the biomechanical marker for a healthy shoulder. Again, perfectly normal. In another volume, I'll show you what a degenerative shoulder and the biomechanical marker on how it looks. But for right now, I'm showing you what a normal biomechanical marker for a normal shoulder, how it looks. Again, Anna, now, with your hands in this position right here, again, just raise your arm overhead and let it come down. Again, she's able to self-diagnose if she knows the significance or the meaning of this particular motion. Now, what I'm going to do now is I'm going to show you on an x-ray what this pattern, how it will look like on an x-ray picture. Because this gives you a clear indication that the shoulder joint, the surface itself, is healthy. So there will be a 99.999% chance that if they would take an x-ray of your shoulder after you perform this maneuver and this biomechanical marker, the x-ray is going to look exactly as I'm about to show you right now. You can sit, Anna. Again, this is an x-ray of a normal joint surface shoulder. You can see the humeral head, you can see the outline right here. It's very clear. The humeral head, it is not sclerotic, it is not white. You can see through it. There's patches of black. The x-ray beam goes right through it. You can see the actual glenoid surface. Again, it does not look stressed at all. This is the right shoulder, this is the left shoulder. Again, you can see the humeral head. There's no osteophyte formation here. There is no mineralization around the borders. Again, you see the glenoid. Again, it does not look stressed at all. Now, the interesting thing about this picture is the elevated humeral head. Anytime you see this on an x-ray, it tells you that most likely there's going to be rotator cuff issues. The humeral head glides upward whenever the muscles or the tendons are stressed. There's a little bit of degenerative condition in the AC joint, but not much. You can see more on the left than on the right. This patient will test negative for the biomechanical marker because the joint surface is is actually normal. This is a normal shoulder joint on an x-ray. Again, if this patient would have come to you, you would do the biomechanical marker, they would test negative. You start thinking in terms of outside of the joint surface itself, around the AC joint itself or the tendon itself. We'll go through it one more time. Humeral head. It's not sclerotic. It's nice and spherical contour. The glenoid, it is not stressed at all. You can see good separation between the humeral head and the glenoid. This is the right, this is the left. Again, you see healthy separation between the humeral head and the glenoid. This patient will test negative on that biomechanical marker. You start thinking outside of the joint surface itself. This is what the biomechanical marker allows you to distinguish joint problems from soft tissue or joint problems outside of the actual shoulder joint per se. Again, healthy. Alrighty. Again, as I've said, this is volume 4 of a continuing series. I will go joint by joint to demonstrate these biomechanical markers and what are their significance. As I said before, every single joint in the human body has a particular biomechanical marker, which allows the treating or the evaluating clinician to conceptualize where the problem lays on your patient, whether it's on the joint surface or if it's on the outside joint surface. These biomechanical markers are very sensitive and very specific. This is volume 4 of a continuing series. For those who see this video, I thank you very much and be looking for us in the future. Thank you.